So we're running a few minutes late, but these are the now monthly last Friday of the month holistic actions Q&As with myself, Jeff Feinman, Dr. Christina Chambreau, and basically we're gonna use these as a way to help you all help your animals choosing a paradigm that is based in love and energy and spirituality and integrates with all the conventional vet stuff that we know, and that's what we just have fun doing. So we're going to do it today. And Dr. Christina, do you want to ask or say anything, or just
Yeah, absolutely. So just a couple of things. It's best if you go to the bottom where it says reactions, and right there, then you put on raise hand, and it puts that little hand up. And when you've finished talking with me, then you lower your hand. So we don't get confused, because I can get confused easily. So there, I was about ready to call on Jeff, but he lowered his hand, so now I don't need to call on him. And that's why it's good. The other thing is, in the chat, if things come up in the chat, which they certainly have in the past, at the end of the hour, you can save the chat. Save it just before you leave. Now, something that happened to me yesterday, I was like, wait a minute, where are my 3 buttons? My 3 buttons for saving used to be down in the chat area where you would type your chat message. Now, my 3 buttons are up at the very top where it says virtual conference and meeting room. So take a minute to go ahead and discover where your save is, so that you'll know where it is when you're ready to leave. Because things have moved around. Even the view seems to have moved around. Okay, so Aaron would like to know how to treat high blood pressure and why would there be high blood pressure. And so Aaron, why don't you unmute yourself?
And just a reminder, Elena, Jean, and Amelia all have their hands up before we get to the
There we go. Can you hear me?
Yes.
Okay, hi.
So why are you asking about Cushing's? Was that a diagnosis that was made?
No, just from a ultrasound, there was a little bit of a enlarged adrenal glands, but everything else looks good. So
one of the important things for everybody is that when I was a conventional vet, when Jeff and I were merely conventional vets, we were focused on, oh, something's a little larger. Maybe it's this. There's high blood pressure. Maybe it's this. And then we would go, let's do tests for these. And then we would go, let's treat these symptoms, because that's the only way that we knew what to do. From a holistic standpoint, the key is to, somebody's got noise.
Yeah, that's not me.
Yeah, no, we're just, whoever is shuffling papers, or can you mute everybody again except for the 2 of us?
I think it's going to mute you.
I'm now unmuted, and you'll have to probably unmute yourself again, Aaron. So we focus on the entire animal, the energy field, the quality of life, the happiness. Now, it is fine to figure out what symptoms are and if there's a problem. But the key thing is to focus on what we call BEAM. And this answers a lot of people's questions. So everybody listen up. BEAM stands for behavior, energy, appetite, and mood. If your dog or cat has great energy, great mood, is doing fine, and has one test that's even way out of whack, take a deep breath and wait, see what happens. Maybe do another test, maybe see what else is going on. And then the other key thing is to take, at the Holistic Actions website, is a free 101 course. And 5 lessons, key. Everybody should take that. Absolutely. It will give you this background on how to be with symptoms and how not to be upset with symptoms. And so the blood pressure, this would be a longer conversation, like, has it been there before? When is it, you know, is it showing any other symptoms? Da, 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 da. And I'll let Jeff go into possible things on that in a minute. But what's more important is to look at these symptoms in context. Of how the dog or cat is doing overall. And the second thing is now for everybody, every single person on this call today, if you do not have a holistic veterinarian that you could call and ask that question of, then it's time to get one right now, and go to holisticactions.com/select. And Dr. Jeff will put that in the both the 101, put a link to the 101 and the select if you would, and read the entire article and find a veterinarian. It's critically important that you have somebody on your side. If you're stuck with that, if you're confused, if you don't get your question answered here and you're not a Holistic Actions member where you could post it in the forum, then that's what I do for a living, is I do pet health coaching. And so you can email me at healthyanimals@aol.com or go to my website, which is my name, ChristinaChambreau.com. And I can help you work through whatever the issues are and match you up with a holistic vet. So Dr. Jeff, what would be the cause of high blood pressure with no other lab problems? Should she even worry about it?
It's probably I think not worth worrying about anything, because the energy of the worry is gonna make it worse and make it harder to resolve.
Should she do any follow-up testing?
Yeah, I would repeat the blood pressure, and if you didn't have an internist do the ultrasound, then you may want to have that repeated, because there is Cushing's is a possible cause, but there's a pheochromocytoma, different part of the adrenal, that can cause blood pressure to increase as well. So if it was an internist, they'd be able to differentiate what zone of the adrenal was enlarged. If it wasn't, if it was your local vet that did the ultrasound, then it's really hard to see.
So Dr. Jeff, so thank you, Erin. Anything
Yeah,
else?
thank you. Could it also be heart disease or kidney issues that we're not seeing on a blood test? Or
Well, you also had a physical exam, and hopefully
yeah, and I do have a holistic vet. She's just recommending a prescription medication that I'm just not too happy about.
Oh, good. So very good, Erin. Thank you for bringing that up. Again, for everybody, this is a critical thing. You are your animal's advocate. And if your holistic vet suggests something that doesn't jive with you, then you may need to find another holistic vet. The first thing is to have a conversation. I don't want to be on a medication like that. What else can you offer? Nothing. Then you go back and you look for another holistic vet. And many do work virtually. So there are many options for working virtually. So Erin, it sounds like if your holistic vet recommended a drug, it's time to have a conversation with her or look elsewhere.
Thank you.
Okay, I can't, Dr. Jeff, you're going to have to call on people because something's covering up the hands raised for me.
Looks like Elena is next.
Okay, go ahead, Elena. You're muted, Elena. You're still mute. There we go. Nope, you're still muted.
Sending a request.
Hello?
There, now we can hear you.
Awesome.
Okay.
Sorry, I'm outside and it's too sunny. Didn't see well. Partially, Dr. Christina answered the question I have in general. The puppy, the dog, he's 1 year old, so he's not like real puppy anymore. We found the tick about a month ago. My holistic vet suggested to use the silver as a preventive. And I think it's not proven, but I think 3 days of half of spoon twice a day prompted the diarrhea what we had. Also, he said that we had to do testing in 2-3 weeks after the tick bite. They didn't save, they removed the tick, but they didn't save it to test the tick. Dog, as of now, Dara doesn't have any abnormal either behavior or I don't see him feeling bad or any reaction to the tick bite. So, and it's 3-4 weeks, I believe, 3.5 weeks actually from the day we found the tick on his trachea.
So Dr. Jeff, would you recommend retesting one time or doing a complete tick panel, or because there's no symptoms, not worrying about it?
Yeah, I wouldn't worry, but I would,
Yep.
get at least one test. But is that what your question was, Elena?
That was the question. Do I have to test him? Or since I didn't see any changes in behavior or any symptoms of any tick diseases, then just let it go and see what happens. Because even if I test him and it will show elevated numbers for any kind of testing, I'm not sure that I will be willing to use antibiotics.
Well, I mean, I'm a data kind of guy, so I like all the information. What you do with the information is different. So I would get a C6 tested at some point. Just put it on the forum. I think you have a forum thread or start a forum thread about this, and
all right,
we'll figure out if we need to do anything beyond sniffing, which actually was my other answer I forgot to give to I think
Aaron.
Was it Aaron? The high blood pressure question
Yep.
was mentioned. Sniffing is really a good way to normalize the blood pressure. So, and I would say it's a great thing to be doing as well for your pup, Elena, for the next, hopefully the next 20 years.
Now, on the other hand, I would say all you had was a tick bite, right? You picked a tick off. Listen, if every time every animal got a tick bite, they got testing or did silver, they would be testing every week. Don't worry about ticks. Don't worry about it. I wouldn't worry about it at all. I would simply always be paying attention to beam, behavior, energy, appetite, and mood, and any of the early warning signs of potential illness. So, which you can see, that's in the course, the 101 course. So for me, if there's a tick, I wouldn't worry about it at all. I would just assume I wouldn't do anything about it. I agree with Dr. Jeff not worrying until you see symptoms.
Yeah, because C6 will give me all the Lyme disease number, but the rest of the diseases.
I wouldn't worry about that either.
Yeah, I wouldn't worry about it.
I had with my hunting dogs, I had everything in a dog. And so I didn't treat him. I just used the herbs and it get over it.
Good for you. That sounds like the way to go.
Okay. All right. Thank you very much.
You're welcome. So I think Jeannie is next. Jeannie, go ahead.
Yeah, hi there. Thank you for taking my question. I don't know how much information you need. I wrote up a whole thing about Tango, who is a 2 to 3 year old neutered male rescue cat. We rescue cats and we have a whole bunch of them, and we have an unfinished building that they take shelter in. And about 3 days ago, Tango started doing this odd behavior. It would look like he was swallowing and putting his neck forward, swallow and then neck forward. And it didn't go away after 24 hours. And so I called the vet and they got me in yesterday. And the vet said his heart sounded fine, his lungs sounded fine. He couldn't, he palpated the neck and he couldn't, find any obstructions. Tango's temperature was 102.5, which they described as, slightly elevated. But other than that, he seemed fine. Now, as far as vomiting goes, like I said, we've got many cats, and I did find a couple of small, places of vomit, right outside one of the boxes that he likes to sleep in. And then for the last 3 days, he normally, runs to us when we go into the warehouse for breakfast to feed him, and he has not done that either. And after, after the vet appointment, I thought, well, and the vet, offered antibiotics, steroids, and anti-vomiting. And I graciously declined all of the, traditional medicine. I thought, if he has ingested something toxic, he needs to vomit that out. I don't like antibiotics. I have found colloidal silver to be far superior as far as infections go. And then steroids would, I thought would just, cover up anything deeper if there was a deeper issue. So now this morning, I didn't see him eat or drink, but he wanted to go outside and lay in the sun. And we've got a lot of nature around us and the woods behind us. And so, that was fine. But now it's almost like his mouth is, bigger. He goes, like that. And
his mouth is bigger as if it's swollen?
No. As far as just opening his mouth. And, the vet thought he was just like swallowing phlegm, but never did I see any drooling. It just didn't, and he doesn't have any discharge from the nose. The first day I noticed odd behavior, it did sound like his, he had a little bit of congestion in the nose, but like not yesterday or this morning, today when I saw him. And no, no drainage from the nose, no drooling, just this really odd, like a fish, and the neck protruding like that, or not protruding, but extending, like that, So,
so my first question is, have you researched to find chiropractic acupuncture vets in your area?
Oh, no, I have not.
So go to holisticactions.com/select. It's in the chat.
Okay.
And see if you can find that, because with your cats, you need that. Also, are you a 501c3 or just doing this on your own?
On my own, yeah.
Okay. Create a 501c3 and people can donate to you. And also consider becoming a Holistic Actions member, because then you can post things like this in the forum and you get a response back to us, and you can post follow-ups and we can help you. We aren't treating your animals, but we can help you figure out if you're going in the right direction or not.
Okay. And I wanted to mention, I was a student of Monique Brignoni, and she was the one who introduced the pet death doula, sacred pet death doula, and she introduced me to you.
Excellent. Wonderful. So at this point, you're just going to have to keep playing it day by day. Any comments, Dr. Jeff, about the open mouth breathing?
Well, yeah, it could be breathing, could be nausea, could be a lot of things. And it sounds to my core that an energetic imbalance will get either self-corrected by your lifestyle changes, by focus on, just what the kitty loves to do, or as Dr. Christina said, getting his channels open better with a chiropractor or a homeopath or
and you can do some yourself by very slow 6 minutes from at least stem to stern, stimulates oxytocin and healing by very, very slow petting. And also I encourage everybody on this call to immediately, so this is now your third immediate, so there are 4 to do right away, but in whatever order you want, get trained in an energetic healing, Eden energy medicine, healthy HTA,
healing touch for animals.
Healing touch for animals, Tellington tea touch, Reiki, scalar healing, all of these, Webb, W-E-B-B, whole energy body balance, Bingston method. All of these are ways that you can be immediately healing your animals, especially when, like for Pumpkin with Knit and with Jean, when animals, you're not sure yet. You definitely don't want to jump to antibiotic and steroids at this point. There's no, you don't know what's going on. But when you're in that in-between stage, often you can turn things around completely. And then learn flower essences. check into a few of the flower essence companies and have them go to their websites and have a few, especially if you have more than one animal, have a few of the flower essences on hand. They can never hurt. Okay. Does that do it for you, Jeannie?
Yes, that does. Thank you.
Great. Couple of avenues for you to go next.
Yes.
And the other thing people can do is you can, for free, you can read our forum. So you can go to the website for Holistic Actions, and on the forum, you can do a search for cat not eating or cat, vomiting or whatever. Because pumpkin is also not eating. So, but as long as, it's fine. The other thing is for everybody, think for a moment if this was you. If the symptoms you're having that have just appeared, what would you do? Would you run to the emergency room? Would you run to your local doctor, or would you wait a day or two and see what's happening? So sometimes that will help you put it in perspective. Okay, Amelia, you're next.
Hi, thanks for having me. I have an 11-year-old Chihuahua that for about a year now he's had digestive problems. What happens is he keeps us up all night and he's just irritated. That's how it started, and so he paws at us all night because he's got a stomach ache basically. So we just moved to Connecticut, so I had a really hard time finding a vet. So I went to 5 vets till I found one that took me seriously and didn't say that, it was just behavioral. And I had an ultrasound and an endoscopy and found out that he has inflammatory bowel disease. But what's been happening is that he's still not right. I've changed his food 3 times to prescription foods. It started with Biome, and then ZD, and then now
in general. So let me, is there something more acute that's happened, or is this, you're just giving me all the different, okay. So the bottom line, have you done probiotics?
Yes, he's been on probiotics.
Okay.
So, and he's also on 2.5. He started with 5 milligrams of prednisone. Now he's on 2.5.
Okay. So one probiotic that actually did studies of getting IBD dogs off of steroids or down on steroids is one called Mito Max. So that's just one to remember that you might want to try for a while. But at this point, the key, and actually Michelle has very similar question because her cat has had loose stools for the last 2 years and they've changed her food a lot. Now they're recommending a hydrolyzed protein diet, etc.
That did not work at all.
So what I'm saying to both of you and anybody else on the call who has GI tract problems is the microbiome is critical in the digestive system, as it is on the skin and in many other organs. So there's some basic keys, depending on how ill the animal is, and again, I'm generalizing this, if they're active and playful still and eating and keeping weight on, even though they have yucky stools and or are vomiting, then you can be doing work on yourself. You can try different probiotics. You could do nutritional response testing, which is a way of, and that can be done remotely. Dr. Jeff can put Dr. Sue Howells in the chat. She can do that testing remotely and sort of make your own food, but be careful about what you're feeding. Feeding a fresh food diet is always important. And then either if the beam isn't as good, they're sort of really sick with this, or you've tried all these things that are sort of on the easier side. You've done flower essences, energy healing, stuff like all the things that are available, acupressure. You've done those, then you need to be working with a holistic veterinarian. And the challenge is finding a good one. And the article at Holistic Actions goes through that challenge, what the challenges are, what you need to do to evaluate a holistic veterinarian. And again, homeopathic veterinarians can work remotely. And I don't know, Dr. Jeff, she's in Connecticut. You're in Connecticut, right? You want to
Yes,
say
they're-
anything? You want to say anything about Connecticut veterinarians?
Not more than it's really hard. I mean, the Connecticut veterinarians now, we're all veterinarians, or it's hard to find a good
very
one.
hard. I mean, I went to 5 vets that gave me gabapentin,
But those were all conventional vets.
but I think
Well-
that made it all worse. That's what happened.
Exactly. Well,
And so-
that's why the holistic actions is here. We are here to support people because we did that. Dr. Jeff and I did that. We made animals sicker. We vaccinated them, pushed them on commercial diets. We treated their symptoms with antis, and they got sicker. So now we don't want people to have to go through that. So Dr. Jeff has created Holistic Actions as a way to actually help hold your hand to go through this. And there are so here's the good news about holistic treatments. Every single condition any of you may bring up can be healed, although not necessarily in every individual animal. The bad news, the challenging side is there are so many different options. You never run out of options, that's good, but now what do we try next? And that's why at Holistic Actions and in the 101 course, you'll learn about holistic medical decision-making, HMDM. First, set a goal. I want to heal my animal completely, not just suppress symptoms with antibiotics, etc. I don't want to just use homeopathic medicines, flower essences, etc., to temporarily fix things. I want a deep energetic healing. And if that's not possible, I want to maximize quality of life. I want my animal to be happy and playful and enjoying life in spite of having some problems. And that often will happen, especially as they get, when they run into more severe problems. So the challenge is, what do you do next? You keep a journal. You look at all the symptoms present and past, and then you try something. That doesn't work, you give it a month. That doesn't work, you move on to the next. You go to a holistic veterinarian. Holistic veterinarian said, give a conventional drug. And you go, no, I don't want that. And so then you move to a different veterinarian. But you may keep going. You may go to one holistic vet for one thing, for your hands-on work, and then you might be working with a homeopathic veterinarian remotely. So you may have to do a combination. Once you really understand that it's all about energy, that it's our energy, our thoughts, our belief systems, what we're saying to the animals, what we're projecting to the animals, that it's about looking for happiness and joy. Somebody, I forget whether it was me or on Holistic Action, said that their dog was just so sick, just really sick, and they were so worried. And and they listened to Dr. Jeff talking about happiness protocol, and they did a happy dance around this flat out animal and perked up and started walking. It couldn't walk. And they did a happiness dance and this dog started walking. So all of that, we talk our Monday night seminars, we have that, and you can access 6 years of that. Or reading, there's so many, there are good books out there. There are many places you can go. So hang in there, Amelia, realize there are answers, look for a vet, go to our forum and become a member. That'd be the easiest.
I am a member. I am a member.
Oh, well then have you posted
I didn't,
this?
I looked, I couldn't find what I was looking for.
Have you
There's
posted?
very little on
There's actually a lot there. Have you posted this question on?
yes, I did.
Okay.
And anyway,
And it didn't help.
I will do it again.
Post again. Sometimes, go ahead. You started to say.
No, I wrote a whole description of the history of Bruce and how, he came to be where he is right now. And and then anyway, it didn't seem to go through, but I will do it again.
Do it
and
again.
spend time.
Definitely do it again. Make sure you do your 15-minute call. And check out Rancho Chihuahua. It's these people rescue Chihuahuas that are in dire straits.
This
And
one's he's a rescue as well.
great, thank you.
Yeah.
And so they have, they're in the West, and they take these Chihuahuas on 4 and 5 mile hikes. And the ones that can't.
Yeah,
And
he's energetic. He goes on hikes with me.
great.
He keeps us up all night, and I could hear he's got a lot of gas at night, and
Yep.
it's
All you
just-
can do is move from one thing to another. Plan on continuing to post.
okay.
That's the trick. Okay.
And I'm gonna interrupt you, Dr. Christina, because we have like
Yep.
3 or 4 minutes to get through each
Oh, my goodness.
question that, well,
Right,
no,
okay.
there's 7 questions and it's about 3 or 4 minutes each. Celia, you're in HA. There are some great IBD webinars, microbiome webinars. A vet specialist gave a webinar on IBD last year. Just go in there and search, and if you can't find it, Aruna will help you. So,
Thank you.
Dr.
Thank you.
Christina, you better move on.
So Christine is next. Christine? We can't hear you. You've disappeared.
Here I am.
Okay, go ahead, Christine.
So I have a 3-year-old female GSP. She's a rescue. She is due to have she has severe hip dysplasia. So she's due to have a hip implant in April. Is there anything I can do to support her pre or post-op, post-surgery, other than what the typical thing is?
Yep, absolutely. And Dr. Jeff actually, Dr. Jeff actually posted a huge link for you in the chat. So be sure you save the chat. There are a lot of different supplements. Arnica after surgery, especially something like a hip implant, can make a huge difference. And the other thing is I would check with an animal intuitive, and especially back to Amelia with Bruce, you might want to check with an animal intuitive to see if there's something you can do just before bedtime or flower essences that might help that being awake. And find out, Christine, how your shepherd, how your female is feeling about this happening. And is she completely lame and she can't walk?
Oh, no. No,
Why
she's
are you,
not. She
why
can
are you
walk.
doing the hip? Why are you doing a hip transplant?
Well, she bunny hops. She bunny hops. She has severe hip dysplasia in her right hip.
Okay. Okay, I have a, when is the surgery scheduled?
April 25th.
Okay. If you want, in addition to this, you may want to do a little researching. When you go to holisticactions.com/select, go down, all the way down, there's one that says Rehab Veterinarians, and that's Laurie McCauley. And it may be that there are exercises that you can do where you may not need to do actually the total hip replacement. And it's a choice. I just had a total hip replacement 2 years ago because I was in so much pain and nothing I'd done for 20 years helped. But I'm just saying, because also post-op, you wanted to know what could help. And also post-op, the more gentle, when you're working with somebody who does rehab, especially holistic rehab, they'll be able to really help. Chinese medicine with acupuncture or acupressure can also help. So if you don't have a holistic vet yet, I would definitely get one now to help post-op.
I have Seibel Mobile Vet, Sherry Seibel.
Oh, she does laser, so that should help. But you may want to look at Jordan Cosen in Springfield, Virginia, because he has a whole lot of stuff. Check out Kosen. That may make a big difference. And somebody in Ellicott City, I can't think of her name now. She does tons of agility work and rehab and that kind of stuff.
And wait a minute, Ellicott City would be much better than Springfield, Virginia.
I don't remember her name.
And what is this for? This is for
rehab. And if you want more of this, probably get hold of me. If you go to you'll get all this from Selective Vet. I just happen to live in Maryland, so I'm giving you a little extra stuff. But if you want to email me, go ahead. I can't spend the time here to give you a list of veterinarians. Sorry.
Okay, thank you. And one more thing. How would I again, how do I save?
At either the bottom or the top, there are 3 dots. You click on the 3 dots and it says Save Chat.
Okay.
You can go back and forth with Dr. Jeff on that on the chat if you can't find it. I need to move on. We have 30 people with questions. Okay.
Thank you very much. I appreciate it.
Sure.
Thank you.
Tasha, you're next.
Hi. Just really quick, I think. So do you have any advice about selecting somebody to do just a dental cleaning? Because our dog hasn't had a dental cleaning yet. He's 3, and watching your videos and stuff on the resources, I know it seems like it's really important to get the right person. So I just wanted to
So you are a member?
I am a member, yeah.
Great, wonderful. So are you feeding big chunks of raw meaty bones or big chunks of meat?
Yeah, he has raw meaty bones regularly.
Okay.
Yeah.
And are you seeing any tartar building up, any discoloration?
Yes, on his canines, especially on one side, yeah.
Okay.
Yeah.
Make sure that side is chewing. Sometimes for whatever reason, they're not chewing on one side, and you might have to hold the chicken neck or chicken back and work on that side.
Okay.
And then if you go to the webinars, we had, who was the speaker, Dr. Jeff, on non-anesthetic dentistry that we had?
Oh,
Yeah.
that was a couple of years ago.
I watched
there were
that.
a bunch of them,
Okay.
yeah.
I did watch that, and I wondered about the non-anesthetic, but then I watched some of the other ones and they were saying that anesthetic was better, and then I got a bit confused. But I just want to make sure I get someone good.
Well,
basically.
the confusion is there is no one right answer for anything. And Dr. Jeff and I I know how I am about it is I don't know which is better. I lean towards the non-anesthetic dentistry, that I can recognize people's concern about things might get missed. I would certainly at this point, where you have fairly clean teeth, I would look for a non-anesthetic dentist.
Okay.
And
if I can't find that,
maybe post on the forum, see if anybody else has that. And then, do you have a holistic veterinarian?
I did. I conventional one. We haven't got a local. We haven't been able to get that. We
Okay,
have tried.
well, then
we're in the
need to
UK, so we're
Oh, well, still, there are plenty in the UK. And so in the UK, if you go to the Select article, we actually have the homeopathic vets for the UK and the Acupuncture Vet Association for the UK.
So you're saying it would be better to get a vet like that to do the dental cleaning?
Oh, yeah, absolutely.
Yeah, okay, great. Thank you. That's helpful.
Because, so here's the thing, I'm a conventional vet. I anesthetize the dog. I have all these tools. I open his mouth, I go in, and I'm chatting with my friends about whatever is going on in the rest of the hospital and my technicians. I'm a holistic vet, and I'm going, okay, Poopy, we're going to be anesthetizing you now, and you're going to do great, etc. Okay.
Got it. Great. Fantastic. Thanks so much. Got it.
You are welcome. Shelley is next. And actually, just before you start, Shelley, the person in Connecticut, be sure you check the chat because it's got McCadden said, we know a DVM who does chiropractic, acupuncture, holistic consults in New Paltz, New York, a day trip from Connecticut. Can you post the name of that person? Or
yeah, I'm happy to DM if that person would like that information.
okay, perfect. Figure if you'd post it in the whole for everybody, because there might be other people in that area, so that would be wonderful. Okay. Oh, that's McCadden right here. That's who okay, go ahead. It's your turn.
Oh, is it our turn? Okay.
Oh,
This is Shelley. I don't think I got a chance to go just now.
oh, I'm sorry. Oh, that's right.
Go
You
ahead,
got-
Shelley.
I'm
sorry. I took my hand down once.
You
once
did.
it was called. So.
Go ahead. I'm sorry. You're next.
Okay, I'll try to make this brief.
Yeah.
Thank you so much for offering this webinar. I have a 6-year-old cat with advanced lymphoma. I was just able to get her to an oncologist. They are so backed up, and they are really pushing doing chemotherapy protocols. She is currently on dexamethasone steroid. She has not shown improvement on that steroid for 3 days. And I am seeing her giving me end of life signs. Hovering over water, she's not eaten in 5 or 6 days. When she eats, she's not able to hold it down or process it. She has gastrointestinal lymphoma that is really messing up her digestive system and her abilities. I'm very hesitant about pursuing the whole chemotherapy thing at this point, especially as she is so weak and I do not want to put her through suffering. And I'm just curious about your thoughts on all of that from a holistic perspective. I have done IR and red light therapy with her and not really seen much improvement from that either. If there's anything you recommend, either do or don't do chemo or do with in addition to other things, or to make her comfortable until end of life.
So the main thing is love. Just spend every moment that you're with her, and she may not want you with her every moment. Sometimes they need to be by themselves. Remember what brought the most happiness and joy into her life. Talk about that, review the old times, let her know that you're fine with her staying or going, that it's her choice. And you will be very clear if it's time to put her to sleep. It may not be remotely time for that. Wendy Cooper is an animal communicator who really works a lot with end-of-life transitions, and there are other ones that do that as well. If you want to email me, I can give you some links to some that can help with that. Whether you do chemo or not chemo, to me, it sounds like it's not right for you at this time, but there is no definitive. Do animals respond to chemo? Yes. Does it cure them? No. Will holistic cure them? Sometimes. And it's about, so the key thing is the energy, the loving, and going with what they need and want, which can change each day. And another person that you can speak with is Gail Pope, who had Brighthaven. And Brighthaven was, she had over 90 cats that she had adopted at one point who were all 16 or older. And she did homeopathy, fresh food diets, but mostly love. She just saw these cats as purely healthy. And it was, just some lived to 34, others died in 2 weeks. So there's multiple things. I would look at maybe learning, sometimes you can get this pretty quickly, but getting some energy healers to help you. Do you know Reiki or anything like that?
Yeah, I have an energy healer friend who has done Reiki.
Perfect. I would do that on a regular basis. Learn it yourself if you can, if she can attune you. And you don't even have to, and Dr. Jeff posted Monique's website for Monique Bergoni. And she also is a great death doula and communicator. That it's just that helps you. All of these, Wendy, Gail Pope, Monique, these are all people who can help ground you with what's going on. And if you want to work with a homeopathic veterinarian, then, go to the select article. And, but it may be a few weeks before you can get an appointment. But usually you can usually find one within a few weeks, and that can help. Is that
All right,
enough?
thank you so much. I appreciate it.
And mostly just love her and be grateful for what you have, dear.
Will
It's a
do.
treasured time. It really is. And we've all been there. Dr. Jeff more recently than me, but we've all been there. So we're with you. Take care.
Thank you so much.
Sure. Okay, honey, McCadden.
Hi, so I'm McCadden, and I'm the human portion of Honey Sweet Harmony. And Honey Sweet Harmony has included a pair of dogs and a pair of twin cats. And we are in our second generation of dogs. And you're on the screen here seeing wee Shleev, who I have the question about.
Okay.
She turned 5 in February. She is a whoopsie puppy made by Pyrenees Daddy and a hound mama in the Blue Ridge Mountains of Virginia. She's just under 50 pounds at a pretty good weight. And she came in to Honey Sweet Harmony at 10 weeks old from a rescue group. And I could tell the day we met that she had a higher than what we would hope for typical pink itchiness, and that probably she had a tendency to react to the world with some extra inflammation, and that she would likely be, I couldn't get away with sort of a whole lot of kibble and not kind of immediate support for her tendency toward inflammatory response. So there have been periods of her life, especially in COVID. I'm disabled. She's my service dog, and we sometimes are low income. So there were times we accepted kibble donations for her food, but as much as possible, including now, she has a whole food balanced for a canine diet. And I have, since my original dog Honey of 2001, a lot of experience with.
I'm sorry to interrupt a little bit, but what's the question?
Yeah. So just to say, I'm shorthanding that we have a lot of experience with holistic. So I just want you to know that as a baseline for where we come from. So Shleev specifically has shown symptoms related to acid reflux, and the way we've been handling that is both the food and supplements, and feeding time is morning and midday. And that typically minimizes her licking, gulping, and wanting to eat grass. She still has an interest in eating dirt. I'm describing the acid reflux, even though for the most part, we seem to have her in pretty okay shape with that, because I'm aware that, and also her deeper history, I'm aware it can be related to the symptom I'm concerned about. And that is that a while back, I noticed that there was a growth for her on her chest, close to her right front leg, but on her chest. And it's not a surface skin growth. It is something that is kind of hard and circular under the skin. And I've done...
So let me just quickly.
Go ahead. Yeah, please.
Because we really have lots of people here.
Yep.
So has it been growing?
I suspect it's been growing, but it's not like it's a massive hanging.
Okay. So it hasn't doubled, and it's hard.
I think yeah.
Or soft. Is it a lipoma?
It's hard. It's hard.
Okay,
it's hard.
So it's hard. And is it impinging in her walking or activity?
No.
Okay, so I would just watch it, and I would be focusing on, so when the body can exteriorize problems, this is for everybody. When you have itchy skin, you don't want to suppress it. When you have lumps and bumps, it's better not to take them off. Unless they're in a place where it needs to be taken off. So if an animal has a fatty tumor, which are usually benign, but it's so big underneath the armpit that they can't walk, then you debulk it. If it's a problem, if it's on the eyelid and it's starting to roll the eyelid out or something, or roll it in, then sometimes if the homeopathy, acupuncture, Chinese medicine chiropractic, et cetera, has not released it, then
Yeah.
at that point, you may need to do surgery. But I would just be watching it, but I would be focusing on all of the other symptoms. And it sounds,
Right.
I'm not sure that the key thing is, yes, we soothe symptoms with different approaches, being careful when we feed, what we feed, that type of thing. But we
Yeah.
have to, giving supplements, and this applies to the IBD people who spoke earlier, giving supplements at all. But the key is we need to rebalance the underlying energy field that is producing the digestive problems and so the best way to do that, I would say, especially being of limited means at times, is to learn an energy approach. So I would get Bingston's book, The Energy Cure. I would learn how to do the cycling, and I would maybe think about, explore the whole energy body balance, or web. Those would be the two things I would add in. And what was the name of the vet who you wanted people to know in New Falls?
I've put the link to her bio on their
Okay.
website in the chat.
Great. What's her name?
We call her Dr. B. BEA for Beatrice.
B Ersham Dr. B.
Yeah,
He fed at
that's
the
the-
barn.
Okay. Oh,
Would
she's at
you-
the barn. Okay.
Well, that was years ago.
Oh, okay.
Dr. Jeff, would you mind putting in, my hands were in another place. Dr. Christina just mentioned a book and a technique, and I didn't quite catch to write it down. Is that something you could put in the chat for us?
Yeah, she actually mentioned a bunch of things.
I just put it
know
in.
you did, and I know
You could put the website in if you want.
You've now, Dr. Christina, you now have 1.5
5
minutes per
minutes.
question. 1.5.
I'll just put in, there was a doctor whose last name started with a B, and I didn't catch that.
It's Bingston, and I just posted it.
Oh, thank you so much.
I didn't get the book, which is Energy Cure.
Yeah.
Okay.
So your recommendation is not necessarily to have a biopsy to determine what a biopsy determines.
There's no problem with doing that. Some holistic vets say there might be a problem, but is it needed? My opinion would be no. And that's just my opinion. I'm not giving, I'm not saying
I get
don't do it.
Okay.
So there, we have lots and lots of people. We've been trying to answer everything in the chat, and I'm sure we haven't gotten to everybody in the chat. So I want to make sure, it is only an hour. And so I feel sort of badly when we don't answer everybody's questions, or when I push people to go too fast with their questions. So
how do we save the chat?
There are 3 buttons at the top or at the bottom in the chat box. And you click on those 3. Are you seeing the chat?
I'm seeing the chat.
Do you go to the top? Does it say virtual conference and meeting room?
Wait a minute. A minute. Go to the top. Wait a minute.
Do you see 3 dots?
You now have 1 minute per
Met the
question.
chat.
Just email Kim support at
okay, I see the 3 dots. Finally, they're minuscule. And it says reply, copy, and quote. So click on copy.
No, you have to find it where it says save chat. What did you say, Kim? Does Kim save the chat?
No, but I'll send it to her. If you just email Kim, as anyone that wants to chat, email Kim at support@holisticactions.com.
It's Barbara.
So for everybody, if you cannot save the chat and you want to see the chat, I just entered support@holisticactions.com. And Dr. Jeff will send this chat to her, and she will send you the chat. And then maybe you can find somebody who knows Zoom, and they can teach you next time how to save the chat. So everybody's ready to save the chat.
And actually, I just realized you don't have to even do that. We'll just put an email that you'll get with the recordings.
Oh, okay, great. You get the chat. So just really briefly, Jackie, what's your question? Make it quick. And you're muted. Yep. You're still muted.
Okay. Am I good?
You're good.
Okay, sorry. I know you answered my question in the chat basically, but I'm trying to understand, should I keep my dog like in a crate when I have to visit my sisters over the weekend? They've got 2 male dogs.
So you said you'd talk to Dr. Jeff, or is he veterinarian for your dog?
Jackie puts in the chat, was that your dog was
Yeah.
maybe in heat?
Yeah.
Yes. I just, yeah.
Yeah, you really have to be 100%.
Yeah, no, it's a good idea to keep them separate. Yeah, but in a crate, a female in heat may drive the other males crazy.
Oh, really? Okay. Okay. All right.
Are they neutered?
But she's not sure she's in heat.
She's showing a lot of the signs, and the only reason I asked is because my sister had a dog where she said they missed the cycle, which I don't know how that happens, but
it does.
That happens.
Okay.
The bottom line is, I'm sorry, but we don't know the answer.
Got it. Okay, no problem.
Yeah, and a crate's a really good idea.
Yeah.
Okay.
Be on the safe side.
All right. Thank you. Okay. All right.
Okay, Isabella, go ahead.
Thank you for having me. This is Bumbles. She's 18. And just a couple of quick questions. She breathes really heavy only when she's purring. It's like she opens her mouth.
Don't worry about that.
Yeah, I did take her to the vet and they did an x-ray and she said she's fine. And she's eating fine and pooping fine. She's finicky, of course. But then she has this weird loud meow. It's like
that happens in older cats. Next.
Okay, that's normal. That's normal?
Probably normal.
Okay,
yes.
You do see a holistic vet. So, and one more question, sorry, about one of my dog's teeth cleaning. We do have a vet, not holistic. I moved from California to Austin. I do have one holistic vet in Santa Monica, but they have to anesthetize, they said, for the teeth cleaning, and there be a tooth extraction. And I think I don't know if you guys know of anyone in Austin that I could.
Yes, so if you go to holisticactions.com/select, you have to go to read the whole article, go to every website. There are at least 5 or 6 good holistic veterinarians in Austin.
Great.
Don't know the name off the top of my head.
Thank you so much. Thanks.
Yep, okay. Absolutely. And it's going to be a challenge, all of you finding a vet. I know it's hard, but my article tells you how to work around it. I really do. Read the whole article. Go to every website. I had to find one for my dog and for my daughter's dog. It took me 2 weeks of work, but then I found a good one.
You did it. You answered all the questions. Awesome.
I don't know. I think we missed some in the chat, but
okay.
We tried, everybody. And those of you who are Holistic Action members and feel like you're not getting the answer you want from the forum, repost in the forum, and then be sure to schedule your 15-minute call with Dr. Jeff or myself, because maybe we can help you more personally with that. And again, if you feel you need more help, my business is pet health coaching, and that's at my website, ChristinaChambreau.com, or email me at Healthy Animals.
And just one more comment, and that's for anyone that's a member or wants to be a member. Monday is going to be our session on, we're starting our energy healing month, but Monday is laughter yoga, and you'll learn all about the happy dance and the happiness, everything. Yep. And that's good for us and for our animals. So we'll see you on
we're going to
Monday.
end this by everybody start laughing as he closes it down.
And have on chat, I was going to unmute. All right. See you around. Bye-bye.